Welcome to Marvin AME Health Ministry. Let's talk about blood pressure. Why is it crucial to get an accurate blood pressure reading? Well, it's simple. An accurate blood pressure reading can be the difference between a healthy life and a life riddled with health complications. It can help identify potential health risks early, allowing for preventive measures and timely treatment. Now, let's dig deeper into the process of measuring blood pressure. Blood pressure is measured using a device called a sphygmomanometer, which comes with a blood pressure cuff. First, the cuff is wrapped around your upper arm and inflated. This inflation causes a slight restriction in your arterial blood flow. As the air is gradually released from the cuff, a sensor or stethoscope captures the pressure at its highest and lowest points. These readings are recorded in millimeters of mercury and are presented as two numbers. The top number represents the systolic pressure, the maximum pressure exerted when the heart beats. The bottom number, on the other hand, denotes the diastolic pressure, the lowest pressure, which occurs when the heart relaxes between beats. So what numbers should raise a red flag? Hypertension is diagnosed after two or more elevated blood pressure readings taken at least a week apart. A normal blood pressure reading is less than a 120 for systolic and less than 80 for diastolic. Anything above these numbers is considered elevated blood pressure. Clinical hypertension is broken down into two stages. Stage 1, hypertension is marked by a systolic pressure from 130 to 139. Or diastolic pressure from 80 to 89. Stage 2, hypertension is when the systolic pressure exceeds 139, or the diastolic pressure goes above 89. There are also categories for dangerously high blood pressure readings. Hypertensive urgency is when the systolic blood pressure exceeds 220 and diastolic blood pressure goes above 120, without major symptoms. Hypertensive emergency, on the other hand, is when the systolic pressure is above 180, or diastolic pressure is above 120, with signs of organ failure, such as dizziness, confusion, and shortness of breath. Blood pressure is intricately linked to heart and kidney function. Therefore, blood tests, imaging studies, and other tests are often used to diagnose hypertension and its associated causes and complications. These tests may include electrolyte levels, blood glucose, thyroid function tests, kidney function tests, urine tests, electrocardiogram, echocardiogram, and ultrasound. To summarize, an accurate blood pressure reading is critical for maintaining good health. It is measured using a blood pressure cuff and sphygmomanometer. The readings are expressed in two numbers representing systolic and diastolic pressure. Any reading above the normal range is a cause for concern and requires immediate medical attention. Proper diagnosis and treatment of hypertension can prevent serious health complications and improve quality of life. Remember, it's not just about knowing the numbers, it's about understanding what they mean for your health.